Sure, here are some common sources of calcium and vitamin D. Sources of calcium. Dairy products. Milk, cheese, yogurt, and other dairy products are rich sources of calcium. Leafy greens. Vegetables such as kale, collard greens, spinach, and broccoli are good plant-based sources of calcium. Fortified foods. Many foods such as orange juice, soy milk, tofu, and cereals are fortified with calcium. Nuts and seeds. Almonds, chia seeds, sesame seeds, and tahini are examples of nuts and seeds rich in calcium. Fish. Canned sardines and salmon with bones are excellent sources of calcium. Beans and lentils. Some beans and lentils, such as white beans, navy beans, and black-eyed peas, contain calcium. Fortified drinks. Some beverages like fortified plant-based milk alternatives and fortified fruit juices provide calcium. Sources of vitamin D. Sunlight exposure. Your body can produce vitamin D when your skin is exposed to sunlight. Spending time outdoors, especially during midday, can help boost your vitamin D levels. Fatty fish, salmon, mackerel, tuna, and sardines are among the best food sources of vitamin D. Fortified foods. Many foods are fortified with vitamin D, including milk, orange juice, cereal, and some yogurt and margarine brands. Egg yolks. Egg yolks contain small amounts of vitamin D. Liver. Beef liver and cod liver oil are rich sources of vitamin D. Fortified supplements. Vitamin D supplements are available over the counter and can be taken to ensure adequate intake, especially in regions with limited sunlight exposure. It's important to maintain a balanced diet that includes these sources to ensure you're getting enough calcium and vitamin D for overall health and bone strength. Role of vitamin D in detail. Vitamin D plays several crucial roles in the body, primarily related to bone health, but it also influences other physiological functions. Here's a detailed look at the roles of vitamin D. Bone health. One of the most well-known roles of vitamin D is its involvement in maintaining healthy bones. It helps regulate calcium and phosphorus absorption in the intestines, which are essential minerals for bone formation and maintenance. Without sufficient vitamin D, bones can become thin, brittle, or misshapen, leading to conditions like rickets in children and osteomalacia in adults. Calcium absorption. Vitamin D enhances the absorption of calcium from the intestines into the bloodstream. This is crucial for ensuring an adequate supply of calcium for bone mineralization and maintaining proper levels of calcium in the blood. Muscle function. Vitamin D is also important for muscle function and strength. It helps regulate muscle contraction and relaxation by influencing the levels of calcium ions within muscle cells. Deficiency in vitamin D may contribute to muscle weakness and an increased risk of falls, particularly in older adults. Immune function. Vitamin D plays a role in modulating the immune system. It has been shown to have anti-inflammatory effects and may help regulate immune responses to infections and autoimmune conditions. Some studies suggest that vitamin D deficiency may increase the risk of certain autoimmune diseases and infections. Cell growth and differentiation. Vitamin D is involved in regulating cell growth, proliferation, and differentiation. It may play a role in controlling cell cycle progression and preventing abnormal cell growth, potentially influencing the development and progression of various diseases, including cancer. Cardiovascular health. There is growing evidence suggesting that vitamin D may have beneficial effects on cardiovascular health. It may help regulate blood pressure, reduce inflammation, and improve endothelial function, which can contribute to a lower risk of heart disease and stroke. Mood and mental health. Some research suggests that vitamin D may play a role in mood regulation and mental health. Deficiency in vitamin D has been linked to an increased risk of depression, seasonal affective disorder, SAD, and cognitive decline in older adults. Gene expression. Vitamin D acts as a hormone that binds to specific receptors in cells throughout the body, influencing the expression of numerous genes. It regulates the activity of genes involved in various physiological processes, including those related to bone metabolism, immune function, and cell growth. Ensuring an adequate intake of vitamin D through sunlight exposure, dietary sources, or supplementation is important for optimal health. Here's how they interact. Calcium absorption. Vitamin D plays a critical role in the absorption of calcium from the intestines into the bloodstream. When vitamin D levels are sufficient, It enhances the absorption of dietary calcium by promoting the expression of proteins responsible for transporting calcium across the intestinal lining. Without adequate vitamin D, calcium absorption efficiency decreases, even if dietary calcium intake is high. Bone mineralization. Once absorbed into the bloodstream, calcium is utilized for various physiological functions, with a significant portion being deposited into bones for bone mineralization. Insufficient vitamin D can lead to decreased calcium absorption and subsequently inadequate mineralization of bones, increasing the risk of bone disorders like osteoporosis and osteomalacia. Parathyroid hormone regulation. Vitamin D also influences the secretion and activity of parathyroid hormone, PTH, which plays a key role in calcium homeostasis. When blood calcium levels are low, PTH is released, stimulating the release of calcium from bones and increasing calcium absorption from the intestines and kidneys. Vitamin D helps regulate PTH secretion, preventing excessive bone resorption and maintaining optimal calcium levels. In summary, the relationship between calcium and vitamin D is integral to maintaining bone health and overall physiological function. Sunlight exposure. The primary source of vitamin D for most people is sunlight. The amount of vitamin D produced depends on factors such as the time of day, season, latitude, skin pigmentation, and amount of exposed skin. Vitamin D supplements are available over the counter in various forms, including vitamin D2, ergocalciferol, and vitamin D3, cholecalciferol. Supplementation should be done under the guidance of a healthcare professional to ensure appropriate dosage and to monitor for potential side effects.